Hi, my name is Sydney, and I'm going to talk to you about my BSN December 2020 Educated Citizen portfolio through Nebraska Methodist College. My issue I want to talk about today is drug abuse in the homeless population and the correlation between it in the Omaha metro area. So the homeless population, unfortunately, is slowly increasing in the Omaha area by over 1,000 people per year, while drug abuse, while still lower than the rest of the country, is also increasing, meaning that this is something that we need to tackle before it gets significantly worse. Right now, there's no long-term or cost-efficient solutions in the Omaha area, which is just costing the city billions and billions of dollars. Unfortunately, part of the challenge is that homelessness and drug abuse go hand in hand, so you can't treat one without having to treat the other. Now, I want to use my tools as a reflective individual, effective communicator, and change agent to understand and look at possible solutions and affect change in the community. This is important to me specifically because I currently work in Council Bluffs ER, where I work closely with a large homeless and addicted population, so I see firsthand the struggles and resources that they don't have. Also, I don't think anyone should have to overcome homelessness and addiction alone because of the lack of resources and solutions. So, we're going to talk about different lessons I've learned over the years to help me affect change. First is reflective individual. So, this is someone that routinely engages in habits of inquiry that influence the ways of thinking and action. This includes critical thinking, using social science and humanities to influence thinking and acting, and analyzes and practices holistic care throughout their career. So, an example of this that I really learned about is a survey called Don't Judge a Book by Its Cover. So, back in the day, I was working in different nursing homes, and there was one guy that was a cranky old man. He would always complain and throw things at staff members, didn't want to do anything. So, one day I had some free time, so I sat on the couch next to him as he was watching TV, and then after a while, he started talking to me. And he opened up and told me about how he used to be a really happy guy. He was a teacher with a wife and 3 kids that he absolutely loved. One day, in a giant crash, his wife and 2 of his daughters died. His other daughter ended up in the hospital for a while. So he stayed there at bedside and lost his job for it. And he brought her home one day. And about a year later, after bringing her home, there was a house fire where he tried to save her and was unable to, unfortunately. So he felt that he just lost everything and everyone and had no reason to live. So he was upset that he was around and his family wasn't, and just felt frustrated with the world. So unfortunately, I couldn't do anything to change him or his perspective, but I did learn a large lesson from it. I learned to take time to listen to others and hear their story, not to judge anyone because you don't necessarily know what they're going through or the challenges that they overcame. This is especially true for addicted or homeless. You don't know what they had to go through or what situation happened to put them in the place that they are now. Another lesson I learned is to think outside the box. So, working in the ER, we had one kid that got his finger stuck in a metal chair when he was in timeout at home. So, the parents tried for quite a while and they couldn't get the finger out. And so, they brought him to the ER along with the full chair. And so, we tried for quite a while with our normal traditional treatments of when someone gets something stuck, which is more than you might expect, and nothing worked. And so we were all trying to figure it out. We even called maintenance down to see if they had anything that would help, and they didn't. So after a while, I was thinking about it, and I had a friend that lived not too far, so I had him bring over the metal grinder, and we were able to, after a couple hours, get the kid's finger out through the metal grinder. That we didn't end up hurting his finger at all, but it really made me realize that sometimes you have to look for answers in the smallest and oddest of places because you don't know what could be of use. So sometimes the traditional answer of going to a homeless shelter or going to NA or AA may not be the answer, but you have to look around for the best tool that can be used for the situation that you're in. Next is effective communicator. So an effective communicator uses critical thinking to connect, generate, and organize ideas as written, oral, and nonverbal manner. So this can include written, verbal, nonverbal skills in a plethora of situations. So, example of this is one woman that helped her find her faith. So she came into the ER one day when I was working. She was suicidal and just felt like there was no hope for the future. She had a bunch of bad things and believed that no one would trust her or believe in her or forgive her. So I ended up sitting next to the lady for a while, making sure that she was safe and whatnot, and I talked to her, and come to find out she used to be extremely religious. She went to church every Sunday, and she prayed every single day, but through all these bad choices, she figured that God would never forgive her. So I talked to her throughout her stay in the ER. So I used to be very religious. I came from a very Catholic family where I went to church multiple times a week. I taught Sunday school, vacation Bible school, and even religious formation. And so I know a thing or two about all of the different Bible verses and stories. So I was able to kind of talk to her. And eventually, after a couple hours, we ended up praying together. And she ended up going up to the behavioral unit over at the hospital that we were at. So, never saw her again, and about a month later, I received a note in the mail, and it was a thank you note addressed to me. And come to find out that when she was upstairs, she started to look into her religion some more, and she started reading the Bible, and she eventually turned to her religion again, and she believes that that's part of the reason that she's made the strides that she is. She had her family back, and she was happy again. And so I really think that I learned that you need to stand by people in their hardest times, even if you don't know them or what they're going through. It's really important to them, and it could be exactly what they need, and it's not going to cost you anything. So another lesson that I learned is unsafe healthcare practices. So this one is a patient that I had my sophomore year in NMC in clinical. So I had a patient that was there for his second knee replacement. He is what I would define as pretty unhealthy, obese, heart problems. He had back problems, hypertension, all sorts of different stuff. And so as I was talking to him, asking my general questions, I ask everyone, he ended up telling me that he's not vaccinated and he takes trips to Mexico a couple times every year to get a full health cleanse and pick up all of his medication for the year. And so me having some knowledge of healthcare knew that this wasn't necessarily healthy. So I went and I talked to my clinical instructor and we got together some different resources for him. And I did some patient education where I talked to him about how vaccinations aren't bad for you and they're not going to make you sick or age you, and the importance of them, as well as the importance of not getting your medication or going to Mexico to get substances that they don't know what they are injected into their body. I even showed him different studies that showed a medication, a bunch of medication brought back to America from Mexico from a pharmacy, and they tested it, and each medication, each pill had a different amount of medication in it. So the patient's not getting their regular even doses every single day. So through this, I realized that he is not purposely making this decision that most healthcare workers would say is bad or a poor choice. It was a lack of knowledge and understanding. And so I learned not to assume people are just making bad choices or that people are doing certain things to destroy their future or their possible it, to destroy their future or their opportunities in life. So before assuming someone makes bad choices, make sure that they actually understand what their options are and what the consequences is for each. The last one is a change agent. So it's someone that uses disciplines of liberal arts and science to analyze historical and contemporary situations and systems to develop cultural competence and take appropriate initiative to effect change. This includes analyzing situations, developing cultural competence, and taking an initiative to effect change. One example of this is when I was in Spanish class in my freshman year at Nebraska Methodist College, we watched a movie called Who is Danny Crystal? Who is Danny Crystal talks about life in Mexico and the lack of opportunities and struggle that they have living in Mexico, and the danger to each person, and how they struggle to try and get into America for these opportunities and to live this golden life. A lot of these opportunities they try and get over for are ones that most Americans don't want and would consider absolutely horrible, or would never want to try and do. One of the big lessons learned here is that everyone deserves a chance for a better future and a better life, and they shouldn't have to die for that opportunity. And that doesn't just go for those trying to get into America, but those trying to better their life from addiction or homelessness. They shouldn't have to die or become injured just trying to give themselves a better chance for a better future. The last change agent is understanding COVID-19. Love my grandparents to death, but they were not practicing COVID-19 precautions at all. In fact, my grandma went to a giant church outing where there was 1,000 people who were all very close. No one wore a mask, and it was right at the beginning of everything happening. And so I found this out, and I had a disagreement with her. So I went out and I got some different masks, and I tried to educate her on why she needs to be wearing the masks. Now, we didn't necessarily see eye to eye, and we ended up having to take a break after the first little bit of conversation, and I came back the next day, and I was able to have a civil and educated conversation about what the virus is, how it works, and the importance of her practicing precautions with it. And granted, she didn't see eye to eye with me at the end, but we did manage to come to a compromise that made us both happy and that we both agreed on to decrease her risk of her and my grandpa getting COVID-19. And this really showed me that a lot of times when presenting options or recommendations, there's going to be pushback or disagreements from different people. But having a civil, educated conversation helps the discussion end in a good place, and is important when trying to figure something out or make choices along with other people. So this holistic and competent care that I was taught while at NMC is very important in being the best person that I can be in my future and affecting change for a better in the world and the community that I live in. I'm going to be able to become a holistic and competent nurse through being an educated citizen, using effective communication, a reflective individual, and becoming a change agent. Use of knowledge of public issues that I've learned throughout the semester while using my own public issue of homelessness and drug abuse, I can affect change in the community for the better. And through my career at NMC, I have become the best version of myself and want to continue to use these lessons that I've learned and learn more to become an even more educated citizen and a better nurse overall. Thank you.